When we see Streptococcus mutans isolated in a blood culture, our first thought is often dental caries. While it is the primary cause of cavities, S. mutans bacteremia is actually a critical clinical finding. It carries one of the highest risks of infective endocarditis among all streptococcal species. In fact, a meta-analysis shows that 47% of patients with S. mutans bacteremia have infective endocarditis. To put that into perspective, that risk is significantly higher than both Staphylococcus aureus at 16% and Enterococcus faecalis at 14%. Despite this, research indicates that echocardiography is often underperformed in these patients, likely because the organism is frequently underestimated as a low-virulence oral bug. The transition from the mouth to the heart is driven by specific virulence mechanisms. S. mutans enters the bloodstream during dental procedures, or even daily activities like eating and brushing. Once in the blood, it uses a nuclease called DOC to evade the immune system, and specialized collagen-binding proteins to adhere directly to the cardiac endothelium. Certain strains are even linked to systemic issues, like cerebral hemorrhage and inflammatory bowel disease. Because the risk of endocarditis is nearly 1 in 2, a positive blood culture for S. mutans warrants an urgent evaluation. First, perform echocardiography promptly, starting with a TTE, but moving to a TEE if suspicion remains. Second, repeat blood cultures to assess for persistent bacteremia. Third, order a formal dental evaluation to identify the source of the infection. And finally, assess the patient for any predisposing cardiac conditions, such as prosthetic valves. While S. mutans is generally penicillin susceptible, the real challenge is the diagnosis. When this organism appears in the blood, we must look beyond the teeth and focus on the heart.